Your doctor looked at your nails and said, fungus. You took the antifungal medication. You used the cream. Maybe you took the pills for weeks, and your nails did not improve. Here is why. What you likely have is not a fungal infection. It is nail psoriasis, and antifungal treatment will never work on it because it has nothing to do with fungus. It is an immune condition, and up to half of all people with psoriasis experience it. If that describes your last 6 months, or your last 6 years, this video is for you. Up to 50% of people with psoriasis develop nail involvement at some point. Yet nail psoriasis remains one of the most misdiagnosed conditions in dermatology, consistently confused with fungal nail infections, causing years of ineffective treatment. Today you are going to understand exactly what nail psoriasis is, how to tell it from fungus, why it hurts so much more than people expect, and how it is properly managed. 4 things: what it is, how to identify it, why it hurts, what to do. Let's start with what is actually happening under your nail. Your nail grows from a structure called the nail matrix, the tissue at the base of your nail beneath the skin. In psoriasis, the immune system attacks this tissue. The same inflammatory signals that cause skin cells to multiply too fast on the surface do the same thing inside the nail unit. The result is a nail that grows abnormally, thickened, pitted, discolored, and in many cases separating from the nail bed underneath. This is not a surface problem. It is happening deep inside the nail structure, which is exactly why antifungal creams applied to the nail surface do nothing. The problem is not on the nail, it is inside the tissue the nail grows from. Here is how to tell them apart. Fungal nail infections typically start at the tip of the nail and work inward. The nail thickens and turns yellow or brown. The texture becomes crumbly and the nail may smell. Antifungal treatment, cream or oral medication, produces clear improvement within weeks to months. Nail psoriasis looks different and behaves differently. The signs include small pits or dents in the nail surface, called pitting, that appear as though someone pressed a pin into the nail repeatedly. The nail may show a yellow-brown discoloration beneath the surface called the oil drop sign. The nail can separate from the nail bed, a condition called onycholysis, leaving a white or yellowish gap between nail and skin. And the skin around the nail is often red, tender, or swollen. The critical diagnostic difference: nail psoriasis does not respond to antifungal treatment. If you have treated for fungus and seen no improvement, that non-response is itself a diagnostic signal. 4 signs that point to nail psoriasis rather than fungal infection. Nail pitting, those small indentations on the nail surface that look like tiny dents or craters. This is one of the most specific indicators of nail psoriasis and rarely appears in fungal infections. The oil drop sign, a yellowish or salmon-colored patch visible through the nail, usually near the base. It looks like a drop of oil under the nail surface. This is caused by inflammation in the nail bed beneath. Onycholysis, nail separation. The nail lifts away from the nail bed, starting at the tip or sides, leaving a gap. The separated area turns white or yellow. In psoriasis, this separation is painless initially, but the exposed nail bed is extremely sensitive. Subungual hyperkeratosis, a buildup of chalky white material under the nail that causes the nail to lift and thicken from underneath. This is the sign most frequently confused with fungal infection because the appearance is similar. If you have 2 or more of these, particularly if you also have psoriasis elsewhere on your body, talk to a dermatologist specifically about nail psoriasis. Now let's talk about the pain, because nail psoriasis is almost universally described as more painful than it looks. The nails are in constant use. Every time you type, button a shirt, open a jar, pick up a key, or shake someone's hand, your nails are involved. When inflammation is active beneath the nail, that constant contact and pressure creates a level of daily pain that is disproportionate to the small area affected. Onycholysis, the nail separation, makes this worse. The gap between nail and nail bed is exquisitely sensitive. Anything that pushes on the separated nail, including light pressure, causes immediate sharp pain. Many patients describe it as the nail being constantly caught on things. There is also what patients describe as nail psoriasis fatigue. The hands are involved in nearly everything we do. Managing constant pain in the fingertips while performing normal daily tasks is exhausting in a way that is difficult to explain to someone who has not experienced it. It deserves to be named. Your pain is not minor. It is not cosmetic. It is the result of active inflammation in one of the most functionally demanding parts of your body. Nail psoriasis is treated differently from skin psoriasis because the nail presents a unique challenge: getting treatment to penetrate through or around the nail structure to reach the inflamed tissue underneath. For mild to moderate nail psoriasis, topical treatments are the first line. Salicylic acid helps soften the thickened nail and the subungual buildup, making the nail surface more permeable to other treatments. Coal tar reduces the inflammatory activity in the nail bed and the surrounding skin. These are applied consistently, ideally overnight when the nail can absorb treatment without mechanical disruption from daily tasks. For more significant nail involvement, your dermatologist may recommend intralesional steroid injections directly into the nail matrix. Highly effective but uncomfortable. Biologics are also highly effective for nail psoriasis specifically, more so than for many other psoriasis manifestations. The most important factor in nail psoriasis treatment is consistency and patience. Nails grow slowly. Even when treatment is working, visible improvement takes months because you are waiting for a healthy nail to grow in to replace the affected one. Treatment working and nails looking normal are separated by 3 to 6 months of growth time. That is not treatment failure. That is nail biology. Before your next dermatology appointment, write down 3 things. When did you first notice nail changes? Whether you have psoriasis elsewhere on your body, even mildly. Whether antifungal treatment has ever produced any improvement. Those 3 answers will shift your appointment from a general skin visit to a targeted nail psoriasis evaluation. You have more power in that room than you think. Nopsor is a steroid-free 2-step nighttime system for psoriasis, formulated with coal tar, salicylic acid, and 8 natural herbs. Both the shampoo and the pomade carry the full active formula, and the pomade can be applied consistently around and beneath the nail edges as part of your nightly routine. Learn more at nopsorusa.com. Nail psoriasis arrived without a clear explanation. It was misidentified, it was treated for the wrong thing, and it kept coming back. Now you know what it actually is. That changes what you say to your doctor. It changes what treatment you pursue, and it changes how you understand what your body has been telling you. This video is part of a complete psoriasis education series on this channel. The full playlist covering psoriasis treatment, including scalp psoriasis, guttate psoriasis, and psoriatic arthritis, is linked below. Subscribe for new videos every week.